This video guide explains the preparation, insertion, removal, and disposal of INLEXZO, gemcitabine intravesical system. INLEXZO, gemcitabine intravesical system, is indicated for adult patients with BCG unresponsive, non-muscle invasive bladder cancer with carcinoma in situ, with or without papillary tumors. INLEXZO is contraindicated in patients with perforation of the bladder, prior hypersensitivity reactions to gemcitabine, or any component of the product. INLEXZO may lead to systemic exposure to gemcitabine and to severe adverse reactions if administered to patients with a perforated bladder or to those in whom the integrity of the bladder mucosa has been compromised. Evaluate the bladder before the intravesical administration of INLEXZO and do not administer to patients with a perforated bladder or mucosal compromise until bladder integrity has been restored. Delaying cystectomy in patients with BCG unresponsive CIS could lead to development of muscle-invasive or metastatic bladder cancer, which can be lethal. The risk of developing muscle-invasive or metastatic bladder cancer increases the longer cystectomy is delayed in the presence of persisting CIS. INLEXZO can only be safely scanned with MRI under certain conditions. Administer INLEXZO intravesically only, using the co-packaged urinary catheter and stylet. INLEXZO should be inserted and removed by a trained HCP, thoroughly familiar with the insertion and removal instructions. For a complete guide to using INLEXZO, please read instructions for use and full prescribing information available on INLEXZOHCP.com. Stay tuned for additional important safety information later in this video. Before beginning, gather all necessary supplies. The product carton contains one sterile INLEXZO, one sterile urinary catheter, and one sterile stylet. Check that the expiration date is valid and examine the packaging thoroughly for cuts, tears, or punctures. Gloves are not included. Since INLEXZO is a hazardous drug, wear gloves and take appropriate precautions. If contact is suspected, immediately wash with copious amounts of water. Advise patients and caregivers to exercise caution when handling urine during indwelling period of approximately 3 weeks. Always maintain aseptic technique to help prevent infection. Prior to opening the foil pouch containing INLEXZO, prepare 2 10 milliliter syringes, each filled with 2 to 3 milliliters of sterile, water-based lubricant, plus additional lubricant for urinary catheter tip lubrication. Syringes and lubricant are not included in the carton. Carefully open the outer foil pouch and remove the inner pouch. Since the outside surface of the white inner pouch is not sterile, it should not be placed on a sterile work surface. At this stage, the INLEXZO pouch and the urinary catheter and stylet pouch are placed on a non-sterile field. Using aseptic technique, gently open the pouches and transfer contents onto a sterile surface. Wearing sterile gloves, remove the plastic sleeves from the ends of INLEXZO and inspect the urinary catheter, green stylet, and outer surface of INLEXZO. Inspect the components for signs of damage. If the packaging or components are compromised, do not use. Lubricate the tip of the urinary catheter without the green stylet and gently introduce it into the urethra by hand. Advance the urinary catheter until urine return. Do not empty the bladder. Use the depth markings as a guide and do not excessively force the urinary catheter into the bladder. In case of resistance, careful assessment and standard procedural techniques can be performed as appropriate in order to safely advance the urinary catheter into the bladder. If advancement is obstructed or cause cannot be determined or resolved, withdraw the urinary catheter to avoid patient injury or urinary catheter damage. Do not reuse urinary catheter. Once the urinary catheter is in place, use the first lubricant syringe to inject 2 to 3 milliliters of lubricant into the end of the urinary catheter. Now, insert either end of INLEXZO into the urinary catheter and advance by hand until it is fully inserted. Using the second syringe, inject an additional 2 to 3 milliliters of lubricant to help advance INLEXZO further. Slowly insert the stylet into the urinary catheter until the hub is flush with the end, ensuring INLEXZO exits the urinary catheter and enters the bladder. If INLEXZO cannot be advanced, remove urinary catheter and stylet together as a single unit and begin again by obtaining a new carton of INLEXZO, including a new urinary catheter and stylet. After successfully inserting INLEXZO into the bladder, remove the urinary catheter and stylet together as a single unit. INLEXZO should remain inside the bladder. Inform the patient and caregivers that INLEXZO will remain in the bladder for the indwelling period of approximately 3 weeks. Advise the patient and caregivers that INLEXZO contains a hazardous drug, and they should therefore exercise caution when handling urine during the indwelling period. Since INLEXZO contains a metal wire, MRIs can only be performed under specific conditions. Complete the MRI safety information card and provide it to the patient. Advise the patient to show the card to their healthcare providers if they need to undergo an MRI. To begin the post-treatment removal process, lubricate and insert a cystoscope into the bladder to locate INLEXZO. Using non-cutting, grasping forceps, carefully grasp INLEXZO over the tubing and metal wire, avoiding the ends. This is done to avoid exposure of the metal wire, thus minimizing risk of potential tissue damage. Remove the cystoscope and forceps together from the urethra, removing INLEXZO under direct vision. Do not attempt to remove INLEXZO through the working channel of the cystoscope. After removal, inspect INLEXZO to confirm it is intact and not broken. Dispose of the used urinary catheter and stylet, INLEXZO, and its packaging per facility procedures and per applicable federal, state, and local regulations. Do not re-sterilize or reuse the urinary catheter. Reuse can lead to its degradation, failure, and contamination, which can increase the risk of infection or transmission of bloodborne pathogens to patients and users. Additional important information regarding administration. Prophylactic antibiotics may be used at the discretion of the treating healthcare provider with each INLEXZO, gemcitabine intravesical system, insertion and removal. Instruct patients to drink approximately 1,500 milliliters of fluids per day during therapy with INLEXZO to ensure adequate urine production for drug release. Instruct patients not to empty the bladder immediately prior to the insertion procedure. Presence of urine in the bladder can facilitate deployment of INLEXZO. Patients can resume micturition after the insertion procedure. During indwelling period of approximately 3 weeks, advise patients to avoid urine contact with skin, to avoid urine sitting on a toilet, to wash hands with soap and water, and to wash their genital area with water after each urination, and to flush the toilet after use. Please stay tuned for the following important safety information. Important safety information. Contraindications. INLEXZO is contraindicated in patients with perforation of the bladder, prior hypersensitivity reactions to gemcitabine or any component of the product. Warnings and precautions. Risks in patients with perforated bladder. INLEXZO may lead to systemic exposure to gemcitabine and to severe adverse reactions if administered to patients with a perforated bladder or to those in whom the integrity of the bladder mucosa has been compromised. Evaluate the bladder before the intravesical administration of INLEXZO and do not administer to patients with a perforated bladder or mucosal compromise until bladder integrity has been restored. Risk of metastatic bladder cancer with delayed cystectomy. Delaying cystectomy in patients with BCG-unresponsive CIS could lead to development of muscle-invasive or metastatic bladder cancer, which can be lethal. The risk of developing muscle-invasive or metastatic bladder cancer increases the longer cystectomy is delayed in the presence of persisting CIS. Of the 83 evaluable patients with BCG-unresponsive CIS treated with INLEXZO in Cohort 2 of Sunrise 1, 7 patients, 8%, progressed to muscle-invasive, T2 or greater, bladder cancer. 3 patients, 3.5%, had progression determined at the time of cystectomy. The median time between determination of persistent or recurrent CIS or T1 and progression to muscle-invasive disease was 94 days. Magnetic resonance imaging, MRI safety. INLEXZO can only be safely scanned with MRI under certain conditions. Refer to Section 5.3 of the USPI for details on conditions. Embryo-fetal toxicity. Based on animal data and its mechanism of action, INLEXZO can cause fetal harm when administered to a pregnant woman if systemic exposure occurs. In animal reproduction studies, systemic administration of gemcitabine was teratogenic, embryotoxic, and fetotoxic in mice and rabbits. Advise pregnant women and females of reproductive potential of the potential risk to a fetus. Advise females of reproductive potential to use effective contraception during treatment and for 6 months after final removal of INLEXZO. Advise male patients with female partners of reproductive potential to use effective contraception during treatment and for 3 months after final removal of INLEXZO. Adverse reactions. Serious adverse reactions occurred in 24% of patients receiving INLEXZO. Serious adverse reactions that occurred in greater than 2% of patients included urinary tract infection, hematuria, pneumonia, and urinary tract pain. Fatal adverse reactions occurred in 1.2% of patients who received INLEXZO, including cognitive disorder. The most common, greater than 15% adverse reactions, including laboratory abnormalities, were urinary frequency, urinary tract infection, dysuria, micturition urgency, decreased hemoglobin, increased lipase, urinary tract pain, decreased lymphocytes, hematuria, increased creatinine, increased potassium, increased AST, decreased sodium, bladder irritation, and increased ALT. Use in specific populations. Pregnancy. There are no available data on the use of INLEXZO in pregnant women to inform a drug-associated risk. Please see embryo-fetal toxicity for risk information related to pregnancy. Lactation. Because of the potential for serious adverse reactions in breastfed infants, advise women not to breastfeed during treatment and for 1 week after final removal of INLEXZO. Females and males of reproductive potential. Pregnancy testing. Verify pregnancy status in females of reproductive potential prior to initiating INLEXZO. Contraception. Please see embryo-fetal toxicity for information regarding contraception. Infertility, males. Based on animal studies, INLEXZO may impair fertility in males of reproductive potential. It is not known whether these effects on fertility are reversible. Geriatric use. Of the patients given INLEXZO monotherapy in Cohort 2 of Sunrise 1, 72% were 65 years of age or older, and 34% were 75 years or older. There were insufficient numbers of patients less than 65 years of age to determine if these patients respond differently to patients 65 years of age and older. Please read full prescribing information and instructions for use for INLEXZO, available on INLEXZOHCP.com. Thank you for watching this video guide.